I note now that the word of a single doctor is enough to confine someone to a mental hospital. Currently, you require the opinion of two. Are you happy and contented with that?
Well, many of the measures in this bill are not the sort of measures that you'd want to bring in, and it's not the sorts of measures that we've seen in peacetime. But frankly, this coronavirus is the biggest challenge to this country in a generation. You know, my generation has never seen something as big and dangerous as this, and we have to rise to it. And the NHS staff are rising to it. It's unbelievable what they're doing already, and there's more to come. And of course, there are laws like the one you mentioned that we have to change that as a country we can get through it.
Why is it necessary to have someone requiring mental health treatment? Why can't you bring one other clinician in?
Because the pressure on the amount of time that is needed for doctors to make these sorts of assessments is very significant. Now, in the vast majority of cases, two doctors making a judgment make the same judgment because it's based on the same facts. And so we think it's a necessary measure, it's a proportionate measure. There's a whole series of measures in the bill, essentially to help to make sure that the country can keep running even whilst a significant proportion of the population are either ill or are being asked to self-isolate in order to keep others safe.
All right, let's move to other matters. What does Germany know that we don't as regards coronavirus? If you're not aware, they've had more than 10,000 confirmed cases, and as of last night, 27 people had succumbed to those symptoms. In the UK, you all know better than I, we've had 3,269 and 144 have died. What's Germany that we're not doing?
So I've talked to my German counterpart about this, and I asked him why he thought that the number of deaths as a proportion of the total cases in Germany is lower.
Well, radically lower, respectfully.
And lower than in France, where it's higher than for us. And his first explanation was that it's because the large number of the first people who caught it in Germany caught it having gone to the Italian Alps and got it and had been skiing and were therefore healthier and less likely. So they think that the demographics of the people who've caught it are different. Younger people on average have caught it. But we keep this constantly under review. That's the explanation that the Germans have given us.
Okay. Can I put to another explanation? And perhaps I'd like your comment on that, which is the number of what are called ICU beds, intensive care unit beds. Germany has 28,000. You'll be aware how many this country has.
Well, I understand that point,
yes.
but the thing is that we do have ICU capacity now. So
but how many ICU beds do we have, Mr. Hancock?
Well, we have around 5,000.
Well, I've got 4,900, so you're virtually there. So 4,900 plays 28,000, Mr. Hancock. What does that tell us?
I'm afraid that is a simplification, because this is a very specific disease that causes, in the worst cases, causes a pneumonia that requires ventilation. So what matters, the most important thing that matters, is ventilation capacity. Now, of course, some people also have multiple organ failure as a consequence of becoming ill with coronavirus, and they absolutely need intensive care capacity. But the thing that we really need to build up is the ventilation capacity, which many of the coronavirus sufferers need, and we're in the process of expanding that rapidly. So, but on the numbers that you measured thus far, there's been intensive care capacity available to all of those people. So it isn't actually a matter of the availability of intensive care, important as that is. That isn't the explanation. If there's another explanation that we can learn from, where we can do something differently, our whole approach to this is to look across the world, to scour the world for who is doing best in responding to the crisis, and to learn from them. All that matters is how well, as a country, we can rise to this challenge.
If we use the Prime Minister's striking metaphor of a sombrero, where do you think we are on the chart currently?
Well, we're still on the edge of the sombrero, I'm afraid. And that's why we've had to take such extraordinary measures to say to people, stay at home, because that saves lives. You need to stay at home unless you have to go into work to work. Some people can work from home, others can't. And of course to go shopping for vital supplies, but stay away from people when you do that, 6 foot or 2 meters, to make sure that you don't pass it on, because it's droplets in the air that are the main cause of passing it on, or of course touching dirty surfaces. Wash your hands. I know we've been talking about that for weeks now, but it is the most important thing for people to do. And the more that people follow the measures that we've put in place, the quicker we'll be through it. And we're monitoring very closely how many people are following it. And if we need to take further action, of course, we don't rule it out.
One group of people you don't want to stay indoors are retired medical professionals. You're calling for them to return. How does that work?
Yes.
And what about insurance, possibly, or training that they understandably might need after 5 years away from the front line?
Yes, important question. So we're contacting people who've recently come off the register, who have been in the NHS, approximately up to 3 years in the first instance. Some of them will be able to get straight back into work if they're very recently come off, say they stopped at Christmas or what have you. Others will require a refresher, and that training's being put in place. Many will require training in the specific needs of this disease. So we're going to need far more respiratory experts than previously. So the letters go out today. That training starts immediately. Some people will be able to get in very soon. The bill that you mentioned takes care of the insurance. We're just going to take on and insure people and give them an indemnity from the government. So we've got that whole program in place to get as many people in as possible. And I'd say if you're listening, and if you're a nurse, a doctor, a paramedic, another health professional who has recently left and given up your licence, your NHS needs you now. Now is the time to respond to the call, because the country needs the NHS and the NHS needs you.
Other people are stepping forward. I refer to soccer star Gary Neville, who's going to make a hotel available. I think the Chelsea Football Club are making a hotel available.
Yes.
Do you see the need where hotel rooms will be required simply because of the number of capacities in hospital?
We may well need that. We're working through that with the NHS right now. We're really grateful for all of the offers. Also all of the manufacturing companies, including Formula One, for instance, some Formula One companies who are turning their manufacturing over to the production of ventilators, which are critical equipment, and there's a shortage right around the world. We're buying as many as we can. We have been for weeks, but we need more.
I'm sure
to
the
be
world
made.
is buying them as well. We're not the only ones, I imagine.
Yeah, but we put out this call at the weekend for people to turn their manufacturing capabilities over to ventilators, and already I've had more than half a dozen prototypes made. I mean, the British people are ingenious when they need to be, and that's great. We now need to increase the number, and I'm sure that will happen. But that's true, and the offers of hotels has been absolutely fantastic. Now, quite a lot is needed to be done to a hotel to turn it into an effective hospital bed, but nevertheless, it's a really good starting point.
I don't expect you to read all the headlines. You're a very busy man at this time. That's my job, though. You mentioned ventilators. There's a story going around that there aren't enough at the Lewisham University Hospital in Lewisham. I don't know if you expect you to know the specific of every hospital. Are there not enough? How short are we of ventilators, Mr. Hancock?
Well, there are. The way to think about it is this: there are hotspots of this epidemic, and there's areas where there are more cases, especially in South London, and also increasingly actually in the Midlands. And one of the great things about the NHS is that we can share the burden. So for some people, if you will be taken to the hospital where you can be best treated, and that may not be your local hospital, and that's fine. That's the NHS working well. I saw the headline that I think you're referring to. It's on the front page of the Telegraph.
Frontline Lewisham, who's got the ventilator?
And you know what I thought? I thought, well, I talked to the head of the NHS about making sure we did that on Monday. And on Friday, it's happening and on the front page of the paper. So for me, that is the system working to make sure that people are being best treated as best they can in the right place. Because we've got to use all of the resources of the NHS. We've got to use all of the resources of the nation to get through this.
I understand that people are going to be told by the NHS in coming days they are the at-risk category. How many people might that apply to, and what puts you in that category?
Yeah, so we're going to publish today the list of conditions which put you at the highest risk, and we're going to write to approximately 1.4 million people who are in those groups.
So these will have pre-existing conditions, Mr. Hancock.
Yes,
yeah,
yes, right. Exactly. So this is a worrying time for everybody, but it's particularly worrying, for instance, for as somebody who's in the middle of a chemotherapy treatment, for whom getting the disease will be very dangerous, but they also need to keep going with the chemotherapy. So people in those sorts of medically vulnerable situations are going to get a letter in the next few days to let them know. We're publishing what the conditions are so that people can see whether they think they're in the category, and we're asking them to be shielded from any social contact. And then we're going to need a whole army of volunteers and helpers to make sure that they can get their supplies, they can get the food that they need. And we're saying to people, check on your neighbour, check if they're in this category. You may not know, because people are often quite private about their healthcare needs. And let's all help each other out. We've seen some amazing outbreaks of kindness and altruism, and I want to see more of that.
It's been reported that in London some paramedics are rationed to one face mask between two operatives. Are you aware of that? And if so, what can be done about it?
Well, I'm acutely aware of the need to get the protective equipment out. We have currently lorries on the road. They're delivering to 150 hospitals overnight. We'll get to all trusts, NHS trusts, which means they're hospitals as well as the ambulance services and the community services, by the end of the weekend. Everybody had stocks in case of something like this, but the big stock is held centrally, and we are currently distributing it as fast as we can, because we appreciate that people are using this kit.
In what's been a blizzard of figures, the scientific and medical advisors who flank the Prime Minister have deduced that it would be an horrific outcome, but a good outcome if the numbers could be kept to around 20,000. Is that the figure you're still working to? Figure of fatalities, is that the figure you're still working to?
Well, we don't put a figure on that because we want to protect life.
But when asked, I'm sure you're aware, one of those advisors is that is the projection, of course.
Well, the goal here is to try to keep this outbreak to the equivalent of a bad flu. If we did nothing, if we'd taken none of these measures, then the estimate is that more than 500,000 people would have died. And that's what motivates me and the team every single day, that we are saving lives and protecting lives. But the thing that everybody who's listening can take away from these sorts of figures, big figures, is this, that by following the medical advice, by staying at home wherever possible, and by keeping yourself apart from others, you are helping to save lives. Because it's only by taking these measures that we can get that curve down and have as few deaths as possible, and then be able to lift the measures as fast as possible. So the more that people follow the advice, the better we'll come through this, and the faster we'll come through this.
Lastly, and I want you to get back to work with you and your colleagues, because you're working so damned hard and everyone appreciates what you're trying to do. There is a sense that perhaps young people, as they continue to go to pubs and clubs, as young as I did once and you did not that long ago when we were both in our respective youthful years, they're being irresponsible. Are they, Mr. Hancock?
Well, everybody should follow the public health advice.
But the young,
should
the young
behave.
are still pubbing and clubbing.
Well, let's see what the facts show. I think there has been a strong reduction, but if we need to take more action based on the figures, then we do not balk at that.
You would close the pubs and clubs if felt necessary.
If that's what's needed, then we will. And we've been absolutely clear all along that we'll take whatever steps are necessary. And, I think a couple of weeks ago when we set out what the plan was and what things we might have to do, people looked at it and thought, crikey, that is extraordinary. But we are prepared to take these actions because we're motivated by saving thousands of lives. And I think that's why the whole country is coming together and in the very large part following the advice, and with the very, very significant consequences for people, for people's livelihoods. And I totally understand that. I come from a background of small business before I went into politics. I understand just how difficult it is, but there's a reason, and there's a reason we all need to come together, and that's because otherwise the virus will kill many, many people, and we need to save lives.